Hi everyone, I'm going to show you how to do a hand tie. Today I'm going to show you how to do a hand tie to form a reef knot, a slip knot and a surgeon's knot. I'm going to start with using this rope that I have, and then I'll progress onto an instrument tie using sutures. This rope I was given at one of the workshops that we did, and it's really nice. It's basically a shoelace that's been color coded on each end. You can use anything you have at home, from a belt to a piece of ribbon, anything that will work. And then you just need something to tie around. In this case, I've just used this acrylic loop. Now, for this demonstration, you can do this with either left or right hand. I'm going to start with the right hand. Let's pretend that the needle is on the tip of this blue rope. You're going to suture towards yourself. So place your suture through the tissue and pull it towards yourself and keep it safe, which means that you're then going to be left with the free end of your suture material. Hold the free end of your suture material in your right hand between your middle finger and your thumb and extend your index finger out. You're then going to bring your suture material up into what looks like a little four, if you can imagine it creatively there. This is what some people call the overhand four or the extended index procedure. You then take your index finger, wrap it around this end and loop it through, and you're going to pull it towards yourself. That creates you the first loop of your reef knot. This free hand then flips over and you bring this needle end close into a loop over your hand, and you'll see that it creates a beautiful loop like that. Some people make the mistake of not letting it fall over the hand but bringing it this way around, and there you can see it's not as round and loopy as it should be. So just be careful of that. Bring it over so that it forms a circular loop. Now you've got both pieces lying parallel to each other. You're going to take your middle finger, take it over the outside, under the inside, and use that to push this free piece down and extend it away from you. And that's going to bring your knot into this beautiful reef knot shape. This is a secure knot that then is going to keep the tissue in place. It won't slip. So to show you again, you take your suturing material, place it through the tissue, pull it towards yourself. Take the free end of your suture material between your middle finger and thumb, extend your index finger, and bring the suture material up into a four. Take your index finger around and press the loop through. Pull that towards yourself. Now you're going to just flip this hand over, place your other end in parallel to it on your hand, middle finger goes over and under, and extend that away from yourself, and that's going to bring you into your beautiful reef knot. That is the reef knot completed. Now to show you the reef knot with the left hand. Again, you've sutured your material through, pulled it towards yourself. You have your end of your suture in your left hand. Here you're going to do exactly the same. Suture material between your middle finger and thumb, extend your index finger out, bring your suture material up to create a four. Your index finger wraps around and pushes the suture material through and pulls it towards yourself. Left hand flips over, you allow this material to run parallel, and your middle finger does the work here, where it goes over and under and allows that one to fall through, and there is your beautiful reef knot. So it's good to practice this on left and right hand, as you may be standing on different sides of the table or sometimes be suturing in funny positions. Okay, now to show you a slip knot. Slip knot is really useful when you want to still create tension on the suture material. So whereas a reef knot secures the suture material and it cannot increase or decrease the size of the knot, a slip knot allows you to really still create some tension and close the loop and then seal it with a reef knot. So a slip knot is basically the same. You bring your suture material through the tissue, pull it down towards you. You're going to have the tail of the suture material in your hand. Again, between your middle finger and your index finger, lift up the suture material to create a four, bring it around and pull it towards yourself. So the first one is exactly the same. Now instead of flipping the hand and doing our second knot, you're going to do the same thing again. So you're going to create the same knot again. And what you'll see there is that this actually creates a knot that is a slip knot. So that will allow us to push the suture material down to as tight as we need, and then lock it with that middle finger knot over it. So you have a slip knot on the one side and a reef knot on the other side. Very useful if you need to create a little bit of tension still within your suture. A slip knot is not stable, so if you by mistake are not watching what your hands are doing and not pulling away from yourself in each of the knots to create a beautiful reef knot, and you by mistake do two the same way, you're going to create a slip knot. And a slip knot is not a tight knot. It's not one that is going to be stable within the tissue. It will come loose. Okay, now for the last one is a surgeon's knot. And a surgeon's knot is basically a reef knot with a double throw. So again, we've brought the suture material through towards us. We've got the middle finger and thumb with the extended index finger. And here what we want to do is do the first throw and then allow the second throw to happen as well. And what we've got there, as you can see, is two throws that have gone around. When you place that down, there you can see instead of it being one single throw, it's two. Now the same thing happens on the other hand. So you take your right hand, flip it over and create the second loop. And instead of just having a single throw, you're now going to double throw it. So as you can see there, it's gone round twice, and that becomes a surgeon's knot. It's basically a double reef knot. Very stable knot, less likely to slip, and again it will stay in position. It won't tighten. As you tighten it there in the tissue, that is how it's going to remain. Let me show that to you one more time. So you put your needle through, suture towards yourself, bring the tail up towards you, suturing material between your middle finger and thumb, index finger extended to create your four. You're going to come through with the one hand, through with the other hand, and tie it down. There is your double first throw. Again, flip the hand over, let it run parallel. You're going to bring the middle finger over and under, loop it through with the left hand as well, and pull it tight into a surgeon's knot. There it is. Okay, so that's reef knot, slip knot, and surgeon's knot on the hand tie.